the station that's on your side. This is Channel 7 News Daybreak.
Welcome back. If you knew that you could do something about the normal effects that aging has on your bone loss, would you make changes? Well, May is Osteoporosis Awareness Month, and joining us this morning from Baptist Health is OBGYN Dr. Rick Wyatt. Rick, thanks so much for being here this morning. We appreciate you. Well, May is Osteoporosis Awareness Month. Let's remind people what that is, because some people forget about it.
Well, osteoporosis is basically brittle bones, weak bones. All our bones constantly go through a build-up, tear-down cycle. So when the tear-down portion of that exceeds the build-up portion, you get brittle bones.
And it happens as we age. What are some of the symptoms that we should be looking out for?
We know early on there's no symptoms, unfortunately. As you get more advanced in the condition, then you might have back pain from fractured vertebrae. Especially in women, you might lose height. We've all seen women with significant osteoporosis that have the hump in the back, the dowager's hump, and eventually the symptoms would be breaking something, have a fracture.
And tell us what causes this. What is it that's causing this breakdown?
Well, it's that where the tear down portion of the cycle exceeds the build-up portion, basically. So, yeah.
Okay, and what we all want to know is how we can prevent this from happening. Nobody wants that humpback that you were talking about. So how can we, especially as women, avoid this?
That's the most critical part of osteoporosis. You don't want to wait till you get osteoporosis before it's treated. So to prevent it, there's several things. We might want to talk about the risk factors a little bit first. Older people, especially postmenopausal women over the age of 65, thin women, thin people that smoke, people that drink excessive alcohol. There's a whole list of medical things like diabetes, certain cancers, irritable bowel syndrome, and the like. But to prevent osteoporosis, at the top of the list would be don't smoke, don't drink excessively. What's that mean? 2 or more glasses of alcohol a day. And then lifestyle changes are probably paramount. Diet and exercise. Diet, you want to have, bone is critical to have adequate calcium intake and vitamin D. So most of us don't get enough calcium in our diet. It's hard to take in 5 glasses of milk a day, which would be what would be necessary. So calcium supplements can be helpful with vitamin D. Most of us, like me, that are out in the sun a lot, have probably very adequate vitamin D levels. Right. But if you're sedentary inside, then you don't.
And there are some treatments out there for this.
There are very good treatments. There's a whole list of treatments, and that would be best to go over with your physician.
Okay, yeah. If you have any of those warning signs, you should talk to your physician or ask about it even earlier if you are a woman and concerned about osteoporosis. If you have any questions, you can always call the Baptist Health Line at 1-888-BAPTIST.